This is Dr. Puja Dewan, your show host on the show Legends of Medicine. And today I am there yet again with legend, and this legend is a senior from my college and institution from which I have studied, no other than Professor Dr. Anil Kumar Bhalla. Sir is an eminent nephrologist and today is the chairman of the Department of Nephrology at Sir Gangaram Hospital, Delhi. Welcome, sir.
Thank you, Dr. Puja.
It cannot be anything more than the immense pleasure that I have in introducing you, sir, today. I am interacting with you today after so many years. Gangaram Hospital brings back fond memories and also the good old days when I used to visit around your department as a part of cross-reference. Sir is a Padma Shri. He is a Dr. B.C. Roy Awardee, a very down-to-earth, humble man with his beginnings all the way from his hometown in Himachal Pradesh to medical college in Amritsar and then Chandigarh and now in Delhi. Sir, I'd just like to ask you today, how has your journey been from your childhood to Chandigarh at PGI, from where you did your MD, DM, and thereafter you also did your National Board's DNB?
Thank you, Dr. Puja. At the outset, I would like to thank giving me this opportunity on your platform to share my life experience, my journey with so many doctors and other in the audience. Actually, the place where I was born in Himachal Pradesh was in a very, very rural area where there was no light, no roads. So it was a very tough life there. My father and mother both were teachers, school teachers. Then every 2 years or 3 years, they used to have transfer in the school. That was a routine. So practically, I have seen all the districts of Himachal Pradesh. And actually, I topped in my metric examination in Himachal Pradesh. And then that was a turning point. When DAV Jalandhar, that was a most premium institution for higher studies in Punjab. They sent one person to Himachal Pradesh at my residence. Once the result came in newspapers that I had topped in Himachal Pradesh board exam. And they offered me to join their college. And they told me that they will give me free books, free milk every day, free fruits every day, no hostel fees, and my tuition fee was also waived off. So that's how I came to DAV Jalandhar. I did my prep and pre-medical there, and then I got selected in MBBS course at Government Medical College Amritsar, which is the oldest college, one of the oldest college in our country. And all the, in fact, prominent doctors, all regents, they have passed from Amritsar only, and they shifted to PGI Chandigarh as well as AIMS. That's how Amritsar Medical College was actually breeding ground for good doctors. So I have a brilliant career in Amritsar Medical College. I topped in almost 6 subjects and got medals.
Wow, sir.
And then I got selected in MD Medicine in PGI Chandigarh. In fact, that was after many years, anybody from Amritsar Medical College had been selected in PGI Chandigarh. It was really a great change for me, because the PGI Chandigarh training and the education, the study pattern was totally different. And it was totally based on actually somehow in like in Harvard or in Tufts, Boston, basically American college of any American system of medicine. And that's how was our training. And that was, I think, the main foundation which made my career. A good medical training, good practical training, good research. That was, I think, foundation. And then once there, we see all the super specialists. We never heard of DM actually during our MBBS days. Mm-hmm. It was there only when I heard, but there is something like DM also. So we were impressed by one personality. He was Professor K.S. Chud. He was father of nephrology in India. And we could see how hardworking he was and how he had passion for the specialty. and that's how I got attracted towards nephrology. Then I joined DM Nephrology, and once I finished my DM Nephrology, at that time there were only two doctors who were passing from PGI Chandigarh. There was hardly any place in whole country where there was DM, so there was much shortage of DM throughout the country. Then I came to Delhi. In fact, I was the first DM when I entered Delhi, and I joined in 1987 at Gangaram Hospital. And after that, it is a history. Actually, now almost 87 I joined, and after 87 now I have with the support and guidance and mentorship of Dr. D.S. Rana, who is the chairman of Board of Management at present Sir Gangaram Hospital. He helped me in every aspect in my professional growth. And now, since last 2 years, I am chairman Department of Nephrology, Sir Gangaram Hospital. I had a passion for training, teaching also, and we were very lucky to have DNB in 1992. As you know, all know, yeah. The DNB started here, and then we started with one candidate, then two candidates, and now we have 5 DNB candidates every year.
Right, sir.
So now we have, that means 3 years course, now we have 15 students with us. This is at par with any good institution in the country, whether it is SGPGI Lucknow, whether it is AIMS, whether it is PGI Chandigarh. 5 students in a year is a very good number. So
I cannot second you more than what you are saying. I myself feel so proud to have been an alumnus of Sir Gangaram Hospital, and also having trained there, and also having done my DNB as well there. But sir, from your narrative, what I have gathered most is that, sir, children of teachers, academicians tend to excel. And I have picked up this out of your narrative because I always feel, and probably you do also, that our parents are our foundations. Don't you think so, sir?
Absolutely. In fact, if a teacher parents, as we all know, in our middle class families, the most important task, most important job, maybe most important hobby, whatever you say is hobby, is only to that your children should settle nicely in life. They should achieve excellence in academics, and they should be better than what they have seen in their life. That is, I think, we have seen so many teacher families. They are really so much focused about their children, and maybe sometimes over focused also, that they will not ask them to indulge in any sports or other things and only academics. But maybe because they have their own compulsions. If suppose their children do not become professionals, then maybe that they will not get good jobs and will not settle. That is how the things were going actually. Now the things are different. Now there are so many options available in the market. There are hundreds of jobs available now. At that time when it was our time, that it was only engineer or a doctor or maybe CA, that's all. So there was no other.
Yes. In fact, sir, they used to say that girls, if there is a boy and a girl, as in a son and a daughter, a son is most likely to become an engineer and a daughter to go into medicine. Of course, what we call as stereotypical professions is what we are products of. What at least I am a product of, and I am also a daughter of a family of teachers and academicians, and I feel very much that the children of teachers are their own gems whom they are honing all their life by educating them, and that's how I could identify with you. But sir, as you said, I'm sure you also must have had some hobbies, right?
Yes. As usual in India, everybody first hobby, cricket. So, whether it was in our college days, whenever there is a match in the room, common room, will be one TV, and there will be huge crowd watching the match, especially in India-Pakistan match. So that cricket is always there. You play cricket also, you watch cricket also, so you feel cricket also. And apart from cricket, I am very fond of table tennis also. Then I like watching television. That is whenever I have spare time, I usually watch television. Of course, reading newspapers is every day, but I don't.
As they say that a person who becomes a leader like you, or a person who becomes a pioneer like you, always seems to have a spots behind him, because that brings in him the qualities of accepting success and failure, and also of team spirit. And you have acknowledged Dr. Rana as being your senior as well as team builder. And that is so nice, sir. Moving on, the audience today must know that Dr. Bhalla was conferred with the Padma Shri in 2010 by the President of India, and was also conferred Dr. B.C. Roy Award. Today, sir, having achieved one amongst the higher civilian honors in India, how do you feel?
Actually, I would like to mention here that whatever you do in life, you must have passion. If you don't have passion, you will never achieve excellence. So I was fortunate and lucky that I had passion for medicine, and I had a empathy for my patients, and that really paid off. And it was a reward, a sort of recognition of my hard work and sincerity towards my profession. That's how I feel this award. Second thing is that whenever you get such an award, in fact, you also have more responsibilities now. And the main responsibility is, apart from your professional excellence, that now you have to pay back to the society. Society has given you enough beyond your imagination. Whatever I am today, I never in fact imagined that I will be in this position, that today I will have a department of 7 consultant nephrologists and 18 DNB students, and one of the best recognized center in the country, not only in the country but internationally. So I wanted to pay back to the society, and then I started a charitable hospital in West Delhi, where I try to run OPDs, free OPDs, and serve the poor strata of the society. And wherever possible, through our profession only, I will like to help the needy.
So what is the name of this hospital, and how does this really function?
It is in the name of my father, late Shri Rudradat Bhalla. So hospital's name is Rudradat Charitable Hospital. I know you have a lot of charitable work. You do plenty of work in Chandigarh and around areas, but it is a small hospital only and just OPDs only. But whatever possible, in fact, I will like to have some more knowledge about your charitable activities also, because we should all contribute wherever we can in helping the needy strata of the society.
True, sir. Sir, you have pioneered quite a few things. One amongst them I will share with the audience is about continuous ambulatory peritoneal dialysis in India. Would you kindly explain this to our audience as to what came in your mind when you happened to dwell into peritoneal dialysis, and then how did the continuous ambulatory thing come into your mind? Because these things were instrumental in bringing you to the forefront and also giving to the society.
In fact, it was, as far as renal replacement therapy is concerned, it was hardly any therapy available when we had our training at PGI Chandigarh. So even maintenance hemodialysis was not available to all the patients. So dialysis was being done only for acute renal failure patients, but not as a maintenance hemodialysis. So it was a first center in maintenance hemodialysis opened in Sargandaram Hospital in 1981, started by Dr. Rana. After that, it was only hemodialysis which was available as a renal replacement therapy. While across the world, there was peritoneal dialysis also, which was a home dialysis. It was a continuous process, and this treatment was in the hands of the patient himself. Patient could do the treatment. It was much comfortable. He need not have any visits to the hospital, and the cost was slightly higher. So at that time, I thought that there can be a possibility that we can start CAPD in our country. Then I went to Singapore. I had a short training at Singapore General Hospital, And then I came by the time the economy started opening up, and now the international companies started coming to India. And that's how the Baxter company came. They brought the PD fluid and catheters here. Because earlier, our country, there was all restricted economy. So it was only once Manmohan Singh and Narasimha Rao combination was there, the economy was opened, and then all these things were possible. And at that stage, I started peritoneal dialysis, and I really worked very hard. It was really my passion and my devotion that I used to go in the night also to perform peritoneal dialysis exchanges. And then I got this established. I made a Peritoneal Dialysis Society of India, and I was the founder member of this society, and I was the secretary 2 times of this society. And now peritoneal dialysis already is an established procedure in our country.
So the training that you did, in advanced training in peritoneal dialysis from Singapore, is what brought you to bring the same thing back in India. And of course, the opening of the economy with Manmohan Singh's position as a finance minister and thereafter is a legacy which a lot of people in the country would thank from that perspective, for sure. And so a few years later, I mean, we are all aware that there is a kidney transplant, and the transplant is taken as per the act from amongst the close relatives, or at best from somebody who is certified as being philanthropic and close as a friend. And we were also always challenged with the fact that the person may be willing to donate the kidney, but the blood group ABO compatibility would become an issue. And you brought forth the kidney transplant as a norm from those who were ABO incompatible in terms of blood groups, so that 1/3 of those which were getting rejected, despite the willingness to donate to their kith and kin, can now be incorporated. That has been phenomenal as a change that you have brought forth. Can you share with us what the journey was?
Yes. In fact, as per Human Organ Transplant Act, only the related donors can donate. So there is a big problem. Now we have very nuclear families. So in fact, the only donor available actually, unfortunately, is the wife. It is a wife or the mother. In fact, if you see in our country, almost 70% of the donations are females. Either mother.
In fact, on International Women's Day, one amongst the senior transplant surgeons, he commented that almost 80% of the donations that was for liver transplant, almost 80% of the donations for liver transplant are through women, and men have a lot of catching up to do when it comes to that.
Yes, so that is an unfortunate thing, that why only wife will say, okay, you take my kidney. Liver, such a risky surgery. Liver donor is not very safe surgery as compared to kidney surgery. It is a major surgery. Even then the wife or the mother will opt. So now the problem is that if there are hardly 1 or 2 children now, we don't have more than 2 children, most of the families. So where will be the donor? Now you tell me practically whose brother will opt for today as donor. And if your sister is married, do you think his married sister's family and in-laws will never accept that she should donate her kidney? So there is a practical problem. And as you rightly said, 1/3 of kidney donors, kidney transplants are rejected because of ABO incompatibility. So then I found that a lot of work was going already in Japan. That it started in Japan, and they were doing almost quite a significant number of ABO incompatible transplants. Then how it started, that there once one person from Sweden, he brought a filter. See, that's how that becomes a turning point in your life. There was one Mr. Paul, he brought a filter that is called immunoadsorbent filter. Immunoadsorbent filter. And he demonstrated this filter to us, that once the blood goes through this filter, so all these anti-A and anti-B antigens in the blood of the recipient can be removed through this filter by immunoadsorption. So we have a special columns there in that filter, very small filter, and all those anti-A, anti-B antibodies will be adsorbed. And if the titer is supposed 1:256, with one session only, it will turn down to 1:64. In another session, it will turn down to 1:16. And once it is 1:8, then we can do transplant. So in fact, luckily when he brought this filter to us, and we had a patient who was willing for ABO incompatible transplant. Otherwise, without this filter, the high titer patients would not have been accepted. There was a modality of removing these antibodies through plasma exchange, but plasma exchange could not remove very high titers, and we had not done any transplant before that. So that was how the first kidney transplant, ABO incompatible kidney transplant, was performed in June 2012. And that was again a turning point in our career. And since then, we have done 250 kidney transplants ABO incompatible. We do almost 250 to 300 kidney transplants every year. Right. And it is the largest number in the country. And again, we have taken the lead, and we have trained so many nephrologists in how to do ABO incompatible kidney transplants. And it has been really a boon for these recipients, because otherwise these patients were having no choice except to continue on dialysis. And dialysis, the mortality is much more as compared to successful kidney transplantation.
Lately, we had the World Kidney Day also celebrated. And in that, of course, chronic renal disease is always the focus. And the focus this time was how to bring in lifestyle management and lifestyle acceptance by the chronic kidney disease patients, so that their quality of life becomes better. And amongst that, what was significantly mentioned was that if other chronic diseases were to be compared, like diabetes, hypertension, in fact, CKD is one amongst the most costly maintenance disease, because if you were to continue on dialysis up to 3 times a week, vis-a-vis if you could get a renal transplant, of course, the odds far outweigh. And you're bringing in this technique and this acceptability of a non-compatible ABO patient being accepted as a kidney donor certainly makes waves in this world and country, and I hope that it's not just 250 and the numbers way soar beyond it. That is when you went to Japan and to Sapporo to present your papers?
Yes.
Right.
Sapporo.
And so
then
you
I went to Tokyo Women and Children Hospital, Japan, Tokyo, where the largest ABO incompatible kidney transplants have been done. And it was that is actually Mr. Tanabe, who is the sort of father of ABO incompatible kidney transplants in the world. So I worked with him, and then I gained the confidence. That's how we could start this.
That is very credible, sir. But you also have had deep interest, and you have done up to 5,000, vascular access for hemodialysis patients, isn't it?
Yes. In fact, that is a vascular surgeon's job. So to make AV fistulas, all these radial artery fistulas, brachial artery fistulas. In fact, AV fistula is the lifeline of hemodialysis patients. And if patient doesn't have a good AV fistula, he will not have a proper dialysis, and long-term survival and the results will not be good. In fact, again, I am grateful to Dr. Rana, who taught me this technique, because somehow at PGH Chandigarh, we didn't have this AV fistula training because that is a surgeon's job. But Dr. Rana was, how he started doing it, it was out of compulsion, because he didn't have any surgeon available for doing this job. So then he learned himself at AIMS during his nephrology training, and that's how he started this. And he passed on this to me. And I'm very lucky that I could start this surgery. I really did the almost largest number of AV fistula, all kind of complicated fistulas I could make. And I presented this vascular access work at Sapporo, Japan.
In fact, sir, vascular surgery as a field was completely unknown to me till I came in as a training to Gangaram Hospital, and I found there is a department and a fellowship.
It was not a specialty.
A fellowship in vascular surgery, and at that time FNB or DNB in vascular surgery was practically non-existent, and that's when I came to know.
Yeah.
And as as out of inquisitiveness, I browsed through the internet to find out more about you and about Dr. Rana. To my amazement, credits everywhere said that Dr. Bhalla is a renal transplant surgeon. And then I scratched my brain and I said, I can't be so wrong. But yes, this gentleman certainly has the credit for making these AV fistulas. And probably this is the reason why, this confusion is there. But sir, equally in the same breath, as I saw the positive feedback of so many patients for you, I saw patients say that, why did we not come and meet Dr. Bhalla before? Here's a person who will give you the diagnosis within minutes in your face, what we had been struggling for. People have called you as proficient, and some of them have even mentioned you to be a dynamic doctor. What would you say about this?
Yes, in fact, a lot of people, a lot of my colleagues also say that somehow I'm really fast in my actions. So I don't spend more than 3 to 5 minutes with a patient.
Right.
So once I see the patient, actually, I can make the diagnosis. So it doesn't require 30 minutes or 40 minutes to make a diagnosis. So to make the diagnosis, to make the plan the patient. So sometimes patient says that doctor didn't spend any time with me. But actually, you have already diagnosed the problem and found the solution within those 3 to 5 minutes. And the same my actions are there with my AV fistulas also, my other works also. Somehow I take less time in doing these procedures, and that's how my style of working is there.
As they say that the doctor has caught the pulse of the patient within seconds. You have also dwelled into publications, and you have 60 odd papers for sure that I am aware of. And amongst them, way back, there was a best paper award that you got for survival of patients on peritoneal dialysis in one of the conference of PDSI at Calcutta. Do you remember those good old days?
Yes, because it was a new procedure. So first time I showed that there can be a good survival on PD also, and not that we should not only focus on hemodialysis, just to make aware other nephrologists that this treatment is also equally viable in our country.
And you've written books as well. I mean, you're an author as well, and renal nutrition and metabolism. Am I correct, sir?
Yes.
And what brought you about to do write this book down?
Yes, I am the president of Society of Renal Nutrition and Metabolism. I established this society in 2014. And we are very actively doing, that is again one of my passion, that to promote renal nutrition in the country. And now today I am the president-elect of Indian Society of Nephrology also, which is the largest body of nephrologists in the country.
Yes,
so
sir.
I plan a lot of things once I take over.
You've not mentioned what little information that I gathered about you, that you're also the council member of Indian Society of Organ Transplantation since 2018, executive member of Indian Society of Hemodialysis, of course, president of Indian Society of Nephrology, and also president-elect of the Indian Society of Nephrology. How do you balance your time, sir, amongst patients, amongst innovation, research, book writing, students, societies, office bearers?
I think it becomes sort of habit. Once you are involved in it, then it becomes habit, because it becomes your lifestyle. Yeah, you enjoy. Whatever you enjoy, I think you should do. So I enjoy doing these things. I enjoy my work. I enjoy my seeing patients. Suppose if one day, yesterday somebody was telling me I was busy in my DNB exam. Actually, exams were going on. Today also it finished only at 6:30. So some of the doctors, examiners said me that now the time has come that you should now enjoy life. That you should not do much work and you must enjoy. I said my enjoyment is only by seeing patients. If I don't see patients, I cannot enjoy life. That is the only satisfaction.
Absolutely, sir. I mean, they say that the more number of things you have on your platter, the more space you create for other things to add on, and the better you can allocate time. I mean, life is like a pie chart. You know, you can have as many allocations and then you can juggle things around. So for those people like you who have the bug to work as per the other people, I would say for you, it would be work is worship, isn't it, sir?
Absolutely, absolutely. And now, fortunately, my children are settled now, so I'm free from that, because that is the biggest responsibility for any parents, you know.
And sir, is any one of them following your footsteps in your line?
Yes, my son is a nephrologist in US.
I see.
So, he did his residency in medicine there, and he did his fellowship in nephrology in Tufts, Boston, and then John Hopkins.
Oh.
And now he is a assistant professor in the university. My daughter, she is did her MBA from Wharton, and now she is in New York in IBM as a corporate strategy associate. So both of them are settled well. So that also again gives me enough time to devote to my work, my passion, whatever you can say.
The small little question: did you actually sit and teach your kids?
Yes.
You have the time?
Yes. I used to do all their painting work. You know, in school, you have to make so many projects.
Holiday homeworks, yeah.
All holiday homeworks. So that, in fact, I used to do. Then every day, I used to tell them stories in the night. All those old stories, which were the stories in our time. Like, you know, Eighth Raja, Eighth Rani.
Absolutely.
All stories, Akbar, Birbal. So otherwise, how they will know about these things?
True.
So I used to tell them every night, they will listen a story from before sleep. Then I used to teach them also. Both actually, my wife also, she is also a pediatrician in Vandaram Hospital. So both of us were, as in middle class Indian parents, our only aim in life was to settle our children. Right,
but I'm sure they have done you very proud. And yes. A small little confession I'll make to you. I had, when I was in school, typical as we were talking about school projects, I was in grade 11th or 12th, one of those, maybe 12th. So one of my relative was affected with CKD, went on for dialysis, went on for renal transplant. The kind of exposure as the first degree attendant to the close relative that I got actually pushed me to make an honest project on nephrology and CKD as the topic. And, such is the burden of the disease onto a common man, even today. Yes. With your having led services, like you were the director of the peritoneal services and have been part of peritoneal dialysis societies, what do you think today is the cope-up mechanism that our government of India or the country at large is bringing forth in terms of dialysis units, and is the affordability truly there? We know that Gangaram is a trust hospital, has philanthropy as an aspect, has subsidized rates, has private practice, but there are other institutes also. Where do we stand today?
In fact, our Prime Minister, Mr. Narendra Modi, he has launched a Prime Minister National Dialysis Program, PM National Dialysis Program in 2018.
Right.
So they started with hemodialysis only, and now recently they have introduced peritoneal dialysis as well. So that is a very, very heartening and encouraging step as far as treatment of CKD patients, dialysis patient is concerned. But at state level, so many states are actively involved in charitable work. Number one top in the list is Gujarat. That was once when Narendra Modi ji was chief minister there. He started this free dialysis, and even today also they give free dialysis to all the patients, plus 300 rupees they give as a transport charges also for the patient to come to dialysis center, and they can afford it very well. This is started by chief minister, and is still continuing. Then other is Telangana government, then Andhra Pradesh government. So all these governments, they are already doing lot of subsidized dialysis. Mumbai, lot of charitable NGOs, they are giving dialysis as low as 250 rupees to patients. Then you must have heard in the news in Gurdwara Bala Sahib in Sarai Talehan, they opened 100 dialysis units, 100 machine, state-of-the-art dialysis center, totally free.
Yes, sir.
All medicines, everything. So I think this is not the answer. if we are treating dialysis patient, maximum you can treat is 1,000 patients only. The main stress has to be on the preventive aspect, and the two most common causes of end-stage renal disease are diabetes and hypertension. So if you work to prevent the CKD, that is the real answer. Because we have to think as a population of 130 crore, and how many diabetes are there? 1 out of 10 is diabetes in our country.
We are diabetic capital.
Yes, and 1 out of 10 is hypertensive in the country.
Yes.
Then we have so many Ayurvedic medicines, Desi medicines, then these pesticides.
And some misuse of NSAIDs, that itself.
That's why, in fact, these over-the-counter pills. So the amount of antibiotics people and these NSAIDs people consume, all this is causing CKD. And air pollution, smoking, everything is contributing to this high incidence of CKD. And every year, about 2 lakh new patients are added every year in our country. And total, there are hardly 1,500 nephrologists throughout the country. And most of these nephrologists are settled in metro cities.
True.
In smaller cities and rural areas, there is hardly any nephrology services available. So if you ask me honestly, the main stress has to be on preventive aspect. Control of diabetes, control of hypertension, avoidance of nephrotoxic drugs. That is how you can reduce. That is a Herculean task, very big task actually. Who will take over this job? So it is very easy to give dialysis and get come in the limelight. Okay, we have started a dialysis unit. But if you ask me, if you spend that money in preventing the diarrhea, infectious illnesses, malnutrition, infant mortality rate, if you can improve that, maternal mortality rate, you will be saving much more lives.
So prevention is always better than cure, and there is absolutely no denying this fact. And it is always good to keep a disease at bay, no matter how much your trigger factors, your genetics, or your local factors may be. Agreeably so, sir. Coming back, you have been very active with DMA, Delhi Medical Association. They have also conferred you with the Vishish Chikitsa Ratan by the Delhi Medical Association in 2006. And notwithstanding, as on date, you're elected as the executive member of Delhi Medical Council as well, right, sir?
In fact, DMA honored me that they actually recognized me as a professional. And after that, in fact, some of the leaders are from DMA. Once there was election of Delhi Medical Council, Delhi Medical Council, every doctor has to be a member of Delhi Medical Council if you want to practice in Delhi. So it was not a political job. It was not a political post. It was a sort of a semi-judiciary post. Delhi Medical Council. They have got a semi-judicial powers over doctors. So all consumer cases, all complaints come to Delhi Medical Council, very well.
Yes,
so I thought that it is better to go for this election. So there were about 42 candidates throughout the city, and I got elected comfortably with a good margin. And that's how I became the member of Delhi Medical Council. I'm sure I can contribute by joining Delhi Medical Council. And then it is a post for 5 years. So I will be doing as much I can. So we can reform certain laws, certain points which are not in favor of practicing doctors. That you can't.
Good old days when there was no, when Delhi was yet to become a state and Delhi did not have a medical council of its own. We used to be all registered in MCI, under MCI and the capital of India. And then Delhi became a state, and then we had DMC. And I came to know of it when suddenly in my medical college, there was an office of DMC in Maulana Azad Medical College. And that's where it started.
Yes.
And so you have been formerly as well, past treasurer of Indian Society of Nephrology, past vice president of Indian Society of Nephrology, past secretary of Delhi Nephrology, past president of Delhi Nephrology, and so many bodies. How do you carry forward these bodies as on date and amalgamate it with your current positions?
See, that's how actually I started from Delhi Nephrology Society. then went on to become the president of North Zone. Then I became the executive member, then office bearer of all the other sister societies. The main society is nephrology. Then others are like Peritoneal Dialysis Society of India. Then we have Hemodialysis Society. Then that's how, in fact, it is. Then one of the main societies, Indian Society of Organ Transplantation.
Yes, sir.
So I think it is a mutual actually. In fact, once you are prominent in one society, then even other society also want that you should stand for elections in other society also. So sometimes we have a request from some of our leads that why don't you go for this election? That's how it goes.
And you have been so impactful that your organizational skills have also been right up there as a part of the organizing secretary of 2 annual conferences of EDSI, Indian Society of Nephrology, Hemodialysis, all those as well. But the world has absolutely recognized you because you have also been conferred with certain fellowships, right, sir? Could you kindly share with us?
Yes. In fact, I was awarded fellowship of American Society of Nephrology, then FASN, then fellowship of Royal College of Physicians,
FRCS, Edinburgh,
FRCP at Edinburgh.
Okay.
And then a fellowship of Indian Society of Organ Transplantation, then fellowship of Indian Society of Nephrology. These are the main fellowships. In fact, Edinburgh, again, it was a very nice experience to go to Edinburgh and get the receive. They have very good ceremony of like a convocation. I'm sure you have gone.
Sir, did they raise a toast at the end, a champagne at the end of the ceremony? Really? Sir, I am a member of the Royal College of Obstetricians, and then I became the fellow. So the first time I went for the ceremony and they finished, and I wouldn't say little girl, as a young girl, at the end they had this cheese and champagne. And for those who didn't like champagne, it was wine. So I was just hogging on to the cheese.
And the way the whole ceremony they conduct, it is really royal.
It is indeed, sir. In fact, Edinburgh is such a beautiful city. The moment you step into the city, and each and every nook and corner of the city is a person who has given us some or the other thing, whether it is sterilization or whether it's a telephone, or all those stalwarts, every nook and corner are there. How did you feel, sir, when you went to a city like that and you yourself have given so much to our country?
Yes, I really enjoyed that visit, Edinburgh. I really enjoyed. I was there for 3 days. Really.
Right, sir. And how active are you part of the alumnus at Sir Gangaram Hospital? You spent 40 odd years. Today, I'm sure there must be a significant audience from Gangaram. I did share the post and I could see the huge applause and response.
I have almost 100 now, our own DNB students who are working throughout the country, not only in India, but even outside India also. Some have gone to US. So it is I think I always say that it is a sort of nursery. So we produce from this nursery, they go out.
So they move out, but I'm sure they will always remember.
They always have that bond with us. They can never forget this bond with Gangaram. Somehow, like you also said, that bond with Gangaram is somehow you can never forget. And they still want that whenever like we organize a lot of conferences like you have mentioned, and in next pipeline we are organizing international conference of International Society of Hemodialysis conference, which is a global conference next year. After that, in 2023 already Asian chapter of International Society of Peritoneal Dialysis has been allotted to our hospital, Gangaram Hospital. I will be the organizing secretary. So these are huge conferences where from all over the world delegates will come, and we will have speakers from throughout the world. So these are huge conferences. So I'm sure once our students, our own DNB alumni, they will come here and they will participate actively in all these meetings. That is where we have made it a point that whenever we organize a conference, we will call all our DNB students who have passed from our institution.
That is so nice, sir. In fact, amongst your students, can you recall any incident which was different from the others?
Yes. In fact, once Dr. Sanjeev Jasuja, he is a very eminent nephrologist in the city of Delhi. He is in Apollo Hospital Senior.
Yes, sir. I was at Apollo and I did happen to interact with him. I was worked at Apollo.
He came to know, he was junior to me, quite junior in Amritsar Medical College, but not when I passed out, before me came later. So once he passed his MD, so somebody told him that there is one Dr. Bhalla from Amritsar, why don't you go to him and find some job or something like that. So he came to Gangaram Hospital. Then he asked somebody, I want to meet Dr. Bhalla. So then he came to me, he met me. He said, I am Sanjeev Jasuja, I have come from Amritsar, I am from Medical College Amritsar. So I said, okay, chalo, come join immediately. So he said, wait, I told him, you join immediately. Write an application that I am joining as senior resident in Department of Nephrology, recommended and forwarded. I asked him, you just join today only. So he can never forget that incident, that's how he came to nephrology. He never thought that he will be joining nephrology. He just wanted to meet me and discuss.
So was he from the field of medicine then? He had not yet chosen the stream of nephrology by then?
No. So he never thought that he will join nephrology. It was only when he came just to meet me and he wanted to discuss where to settle. I said, you just join as senior resident here. Because we wanted at that time, we wanted at that time there was no entrance test,
right.
So you could select your DNB like that. So if somebody is good, somebody is working well, you will select him for DNB.
Yes, sir. I remember those days. There was no exam at that time, and even if there was, it was like DNB 1, and you've given DNB 1 or you are a post this thing, and you just go and apply, and if the vacancy is there, you just get selected.
Yes. That's how I remember, and he always mentions this in whenever he will meet in our get-togethers. He will also narrate this. So that is one episode. And there is one more certain like our students, even head of Department of Nephrology at PGI Chandigarh, he is our student. So many senior professors in US, they are our students. They always mention that whatever bedside teaching they have learned from Gangaram Hospital, they have not learned anywhere elsewhere, whether in these institutions like AIMS or PGI or SCPJ now. That is the kind of teaching in our department, in our hospital, actually, Gangaram Hospital. You have seen that how much material we have got, academic material.
Sir, there is abundance of patients because you're catering to all strata, including to the lower class. And so there is abundance of patients. And again, there is when there is abundance of giving and abundance of accepting. Yeah. I think that was really different for Gangaram, for me at least. And so any particular patient, any incident, any case which was particularly difficult for you?
Actually, in our specialty, like transplant, it is always a challenge. In every patient, there is a challenge. And that challenge is there, that in transplant especially.
The emotions really run high, don't they?
Yes. In every patient, even when I have seen myself more than 5,000 kidney transplants. One thing I want to share here is that I joined this hospital on 10th of August 87. And same day, first kidney transplant was done in this hospital. So it was as the luck would have it, and the coincidence, the same day first kidney transplant was done. So that is again very important landmark for our transplant program. So we have done more than 5,000 kidney transplants here now. But even now also, in every kidney transplant, once the urine output comes, and then after that, if there is a rejection, that rejection can, that all the time that fear is there, that suddenly tomorrow there will be rejection. Then the most anxious moment was actually when we did our first ABO incompatible kidney transplant.
Okay.
Because when I was taught nephrology, it was absolute contraindication to do ABO incompatible kidney transplant. The first thing was ABO incompatibility. That is an absolute contraindication. And today we were going to do a transplant starting from B to O. B group was donor and O was the recipient. And the moment, once we did everything, but once the clamps were released, artery and venous vein clamps were released, if there is a hyperacute rejection, immediately on the table the kidney will turn blue and patient will be restless, there can be anaphylaxis, and there will be no urine output. But in fact, I was so worried that I did not go to OT that day. And once I asked the transplant team that how, then they said that the clamps have been released and there is a good urine output. That was I think the most important and anxious as well as most satisfying point for me, and that the ABO compatible kidney transplant has become successful today.
I mean, when we hear of all these experiences, to the third party, it may appear like a story tale, which you may tell to your grandchildren tomorrow, that see, this is how we felt and this is how we mastered the act. But as we said, we are all eventually human, and fears, apprehensions, failures, all challenge us. And we don't want to err and be on the other side, truly. Dr. Bhalla, it has been immense pleasure to interact with you. And there is yet another award that I came to know is about Pratibha Puraskar. Do you remember?
Yes, I think this was one organization from South.
Right.
They just wanted to recognize my efforts and all this thing. So they had given me this award.
As we come towards the close of this session, we have been interacting deeply with each other for now nearly an hour. And how time has just flown by is a different story altogether. But I would like to ask you a question that here on today, you have been a path breaker. You have been a teacher. You have been a researcher. But where do you foresee yourself from here now? Besides, of course, working actively, and that work is worship for you. But where do you foresee yourself from here now?
One is that I will continue my passion of seeing patients. I will always continue my clinical work. Then I have already achieved in this. I have become the head of department of nephrology. That was my dream, that one day I will become head of department. Then maybe I actually want to go into administration also in the hospital. So maybe that if I get some good administrative responsibility, I will be glad to hold that responsibility.
You are currently the member of the board of management.
I am already the member of board of management since almost 20 years now. So I am part of administration also. But that is my dream, that if I can go into administration and higher up, then I can contribute. I can go into the decision making position, so that certain things can be done. How to expand the services of the hospital. Not only hospital, even our specialty. How can we expand this? Because like you have seen that already Gangaram Hospital, we are not able to expand ourselves.
Whatever space was there, we have utilized from old building to new building. We can't contain ourselves. We have already taken up hospitals and affiliates even around us.
Yes. And even now you have seen Max Hospital, you have seen Apollo Hospital.
Yes.
Sir. So how these people, they have expanded, how much they have expanded. Apollo, it has visibility everywhere, not only in India, even outside India.
Yes, sir.
How Medanta came only 10 years back, and how now they have made so many centers throughout the country. So that is kind. I think if tomorrow one day I can go into that decision making capacity, that is my thing, because I have a lot to do yet. It is not that I am already tired and I don't want to do this further. Whatever possible, the only I always pray to God that God should give me good health, because health is very important. If you have good health, only then you can pursue your dreams, you can pursue your goals.
It has been wonderful, sir, interacting with you. My journey of this last 1 hour with you has captured more than what I knew of you, and what I have gathered from you today is hard work, empathy, giving back, not stopping, the spark to work, the spark to life, and the intent to grow. And I wholeheartedly salute to this spirit within you. I thank you for having joined the platform today. I, Dr. Puja Dewan, a gynecologist and an IVF specialist completely from the other end of the spectrum, today have been your show host and moderator, and it's been immense pleasure. Would you like to say something, sir, before we close the show?
I must congratulate you that apart from being a very good clinician, very busy, your IVF specialist, and so of your clinical workload, and of course pursuing your hobby of singing, you have been sparing time for this platform. In fact, I only came to know about few days back only that there is such platform there, and you are going to be the host. I had already heard about you and through SGRH alumni, but I am really glad that I could interact with you, and I must thank Omnitourist for arranging this interview today.
Thank you so much, sir. Goodbye. The audience, stay safe. Bye-bye. We'll see you next time again in this show with yet another legend. Thank you so much. Bye.